What is the difference between acute kidney disease and chronic kidney disease? This is Tommie with NurseMinder, and we're going to help you differentiate between acute and chronic kidney disease in this video. Now let's look at acute kidney disease first. Acute. Just as the word suggests, this happens quickly. This can be hours to days before we start to recognize that the kidney's function is declining. Now there are three main categories of acute kidney disease. Prerenal, which is decreasing blood flow. Intrarenal, which is damage to the kidney itself. And postrenal, which is obstruction. And I've got videos on all three of those to help you understand them, so just watch for the links in the description and I'll tag one of them up here. With acute kidney damage, it is potentially reversible, and at the same time, it is a serious contributor to mortality in our patients in the hospital. Patients in critical care units across the United States have been documented to have an increase in mortality rate by as much as 15 to 60% if we do not detect and treat acute renal disease. On the opposite side are chronic kidney disease. Chronic, just as the term suggests, long term. This is a progressive decline in the function of the nephrons, that intrarenal compartment. Acute kidney disease can become chronic if it goes untreated and undiagnosed. Now, chronic kidney disease, because there's this progressive decline, it is not something that can be reversed. There are 5 stages. Now in acute, we were looking at 3 key areas: the blood flow to the kidney itself, and how the urine exits the body. In chronic kidney disease, we are focusing in on the kidney itself, that nephron. And there are 5 stages of chronic kidney disease. All right, so I actually like this diagram. I want to share it with you here for the 5 stages. Stage number 1, imagine your kidney at 100% functioning, it's able to filter 100% of the blood. Stage 1 of chronic kidney disease, there's possible kidney damage. You might see some protein in your urine with a normal kidney function. Normal is 90% or higher. But what we're noticing is that that damage is showing up in our assessments when we do a urinalysis. In stage 2, kidney damage is a mild loss of kidney function. We are at 60 to 89% estimated glomerular filtration rate. Stage number 3, we've got it broken down into 2 categories here. 3A is mild to moderate loss of kidney function. That means the kidneys are able to filter 45 to 59% of the blood that is going through it. And moderate to severe is 30 to 44%. So we've got only a third to less than a half of the function of our kidney. In stage 4, we have severe loss of kidney function. Our kidney is now only able to filter 15 to 29% of the blood, and it is working really hard. Stage 5 is complete kidney failure. We have less than 15% of the blood being filtered. Now there's many contributing factors to a chronic kidney disease state. Diabetes, high blood pressure, infection and inflammation of the kidney, glomerulonephritis. Many of these we talked about in our videos on intrarenal. So go back and watch that video as well to understand what's happening inside the nephrons itself and why that unit is so important. So as a quick summary, acute versus chronic. Acute is that quick, rapid onset, and chronic is a progressive decline in function. Acute, we may be able to reverse it if we can identify it and treat it. Chronic is not reversible. There will be a decline unless we continue to maintain kidney health. When it comes to acute, we've got those 3 main areas we're looking at in terms of troubleshooting where the issue is: before the kidney, in the kidney, after the kidney. Chronic is the kidney. This is Tommie with NurseMinder. Give me your comments and questions below, and I might just be answering one of your questions in a future video.